Welcome to this session on the future of connected health, operationalizing privacy and security in the cloud. I'm Wayne Sachs, Vice President of Solutions Architecture at ClearDATA. Healthcare is accelerating its move to the cloud, but getting there safely and securely is challenging. So why is moving to the cloud so hard? We at ClearDATA have been in this environment working with AWS for about 10 years, focused entirely on healthcare workloads in the cloud. And what we've come to understand across the variety of customers who we've worked with, either payers, providers, biopharma, health tech companies, is that there's three things in common. So the first is that policy expertise is needed to support cloud operations and implementation. You have to understand the complex regulatory environment, including HIPAA or HITRUST, GDPR, and other nationalities and regions, local regulations. And then you need to be able to understand all of those regulations within the context of the cloud environment that you're working in. So you need a special type of person who's not that easy to find. The second thing that you need is technical expertise. You have to have multiple SMEs covering multiple disciplines. And that's just in order to run and operate your cloud environment, let alone build the workload that you're going to deliver to your customers. And then finally, in order to keep it safe, secure, and compliant, you need to weave together multiple point solutions. Some are available through AWS, some are through third-party vendors, but it's difficult to integrate them all into a comprehensive solution that gives you a unified view of your security and compliance status. But you need to have a unified view of your current state in order to ensure that you are meeting your obligations, your regulatory obligations, your security obligations. And the challenge that weaves through all three of those is that these skills aren't necessarily related to delivering health outcomes, which is ultimately the thing that our customers are really focused on. So this is very much ancillary to their purpose. And so ClearDATA has come to the market to address these challenges and to give innovators like Dave the ability to deliver solutions to his customers who are really focused on health outcomes and let ClearDATA focus on the elements that we're good at.
Hi, I'm Dave McCutcheon, Chief Operating Officer of InfoBionic. Today I want to talk a little bit about our company first. InfoBionic is a cardiac monitoring company founded in the greater Boston area. Our foundational software, called MOMI ARC, was designed around the thought that we need to provide full continuous monitoring of patients outside of the hospital. This is especially important for those who have known cardiac arrhythmias. And we provide real-time alerts in the system because we provide a 24-hour near real-time stream of the full disclosure ECG data. And using 12 patented algorithms, we monitor that data, have those confirmed by human cardiac techs, and then notify physicians if a dangerous arrhythmia occurs. We develop both the hardware and the software solution. And as we think about why did we choose ClearDATA in that journey and why are we on AWS, deploying on cloud rather than on-prem allows us to scale the way we need to bring on large patient volumes, new customers, and to do the type of cloud integration in a compliant environment that's required in today's really growing and expanding remote cardiac monitoring world and today's remote patient monitoring world. So a little bit about the journey and why we did choose ClearDATA on AWS. So I would say anybody who's considering developing and deploying a SaaS solution, specifically in healthcare, is that you need to pick the right partner who can help you get to the market fast. So many times when you think about designing of products and deployment, and you're dealing with the struggles of health systems and their requirements for their infrastructure and uptime guarantees, it's very difficult to meet those demands without deploying like we did on AWS with ClearDATA. With the safeguards that provide us our cybersecurity, our compliance, our reporting, This allows us to focus on product innovation and bring new features, functions, new software to the market much faster than we could have without this approach. You know, one of the things that this does for us is it helps us manage cost as a small company. This means we don't have to have a full staff whose whole job is maintaining infrastructure, staying up and being on top of new policies, guidance documents, and I would say dealing with constantly evolving threats and other challenges. We all hear about how cyber attacks are becoming more frequently, and every single event has the possibility to interrupt patient care. And as a Class 2 medical device, it's important that we are able to provide a safe and secure solution for both our patients and the providers who use it. I would say that hosting on AWS with ClearDATA safeguards allows me as the Chief Operating Officer to sleep well at night, knowing that I have a whole host of experts in this field backing up our product. And for our customers, it also provides them that comfort as well. We take advantage of the environment by providing zero downtime upgrades. And in some of our contracts, we achieve and support 4 nines uptime, which is generally a hard thing to achieve in any type of healthcare IT environment. So it's not just about the day-to-day and how we got here that's important. It's about the ever-changing landscape in healthcare and new challenges that we face and the importance of the partnership we have. So when the COVID-19 first hit, we saw a rapid decline in utilization of our services. And this was just due to the fact that physician offices were closed, patients were unable to make it to their appointments, people were afraid to leave their homes. And during this, we saw a rapid scale down. What we did see then is ultimately is that our IOs, our storage, and our compute had dropped by more than 50%. But thanks to some working with AWS on their savings plan and ClearDATA partnership, we were able to weather that storm. And as we came through and out the other side, we subsequently have seen a 40% increase in our patient utilization on the system. And the best part about that, that's 40% over pre-pandemic levels, and we did not see a commensurate rise in our cloud cost. Remote patient monitoring solutions grew rapidly. There were a number of new solutions provided with all types of devices connected, whether it was SpO2, blood pressure, scales, a temperature for thermometers, all these devices were connected. But what we were able to provide was a true diagnostic level ECG at all times during the pandemic. We could say that what we also saw, and another advantage of being in the cloud, was our ability to quickly deploy and integrate to large health systems. So again, in a response to these new COVID-19 era challenges, we saw health systems who needed to have a remote model. We launched a program called Remote Me, which allowed us to ship the devices directly to patients' homes, get the patient onboarded, and then we were able to deliver those results back to the physicians who ordered those because we saw high demand in EMR integration. Again, our partner on EMR integrations is hosted securely on AWS. This allowed us for rapid deployment and rapid adoption among large health systems. You know, I think one of the things that has enabled our success over this period of time since I joined InfoBionic and going forward is the true collaborative nature that we have working with both AWS and ClearDATA. You know, I would say that if we didn't have the flexible cost model to allow us to weather that interruption event, and that we didn't have a partner that allowed us to scale back up as we rapidly grew over the last year, and to do it in a manner where there was no challenges to service and there were no challenges in staffing growth, it was important. You know, so I would say that between our balanced AWS savings plan, our reserved instances mixed in with some microservices really meet our fluctuating demand and ensure that we are poised properly for more growth. When we tie that together with what ClearDATA has provided for us, HITRUST certification of the platform, automated HIPAA reports that allow us to provide these reports on demand to our most demanding clients, we could say that we can give that same comfort to our clients that their patient data is always safe and secure. The entire environment itself, where we run both our development as well as our production environment, that really gives us an advantage in that we can onboard customers quickly. We can do things at scale that we never could have done if we were working with customers or in a scenario where we were doing back to on-premise. I would say that managed cloud services really are a force multiplier to our success. And I would think that anybody who's looking forward to how do I best deploy, how do I best solve some of the biggest challenges in healthcare related to privacy, security, compliance, that finding the right collaborative partners is the key. Wayne, I'll hand it back to you.
Thanks, Dave. Dave just talked about the partnership between ClearDATA and AWS. And that's also embodied in the shared responsibility model. Because the shared responsibility model sort of creates the terms of how we operate and how we come together to support our end customers. So what you see here on the left is the classic model. AWS is responsible for the security and compliance of the cloud. They're responsible for the physical security. They're responsible for ensuring that there is power and internet access to the buildings that the servers are hosted in. They're responsible for staffing the security guards. And they're responsible for the software configuration that makes the cloud, the cloud. But where they've drawn the line is in the workload. The customer is responsible for the security and compliance in the cloud. And for many customers, like we talked about earlier, it's difficult for these organizations because they're not really focused on the security and compliance in the cloud. They're focused on delivering patient outcomes. So that's where ClearDATA has come to play. So ClearDATA works very closely with AWS to think about the shared responsibility model in the context of these healthcare organizations and what they need to be good at. So ClearDATA has come along and we said, we're going to take responsibility for a bunch of things that are typically above the line from AWS's perspective that aren't really the core capabilities and competencies of your average healthcare organization. Things like ensuring the security and compliance of the platform, of the operating systems, the network, firewalls, and all of those things. So that we have the capacity to bridge the gap between the services that AWS provides to us, which are HIPAA eligible, and the configuration of those services so that they are in fact deployed in a HIPAA compliant manner. So thinking back to the reasons that healthcare is having trouble moving to the cloud quickly, again, it's requiring healthcare regulatory expertise, requiring strong technical execution, and requiring fragmented point solutions. And all of that is driven in meaningful ways by the way that the shared responsibility model asks or demands that our customers do things above the line. So what we've done is we've created a set of solutions to map to the three main areas that have slowed our customers down traditionally. Our policy is code engine, which attempts to solve the problem of regulatory expertise, our managed health cloud, which attempts to solve the problem of technical expertise, and our cyber health platform, which attempts to solve the problem of the need to weave multiple point solutions together. So this is the platform sort of in another view. The policy is code engine on the left takes the state of the regulatory environment, all HIPAA, HITRUST, GDPR, and the specific rules in a lot of ways, line by line, what these rules are requiring, and maps them to individual cloud services. So that we can say for any individual cloud service that is HIPAA eligible, this is the way that it must be configured in order for it to be compliant. And that's a big distinction. And so that policy as code engine informs our platform, our cyber health platform, of the technical controls that it must evaluate on a regular basis, every minute of the day, every change that's made, and looking for deviations to security and compliance best practice. And where deviations are found, pushing it back with automated remediations. The cyber health platform also provides compliance dashboards and reporting so that auditors and compliance individuals have an easy way of seeing the current state of their workload. And it provides the capacity to identify where PHI lives in a workload and who's accessing it, which is a combination of a technical and a procedural control that our customers are required to do by the various healthcare regulatory frameworks. Above that is the cloud operations, managed cloud and managed security. And so those organizations are designed to alleviate the need for specific technical expertise in the cloud. Cloud operations feels a lot like a like a classic MSP, but it's focused entirely on healthcare workloads. So everything that it does is within the context of living up to the regulatory and procedural requirements that our customers are required to follow. So cloud operations manages patching and security events and the sort of the typical things, but it also does that within the context of HIPAA or HITRUST, these frameworks. Managed defense is a really interesting capability. What managed defense does is it provides a defense in depth capacity to our customers' healthcare workloads. And it's constantly collecting telemetry from all of our customers, as well as public feeds and other data locations, weaving that in to enrich all of the information that we have about our customers' environments, oftentimes giving us the capacity to prevent bad actors from doing bad things to our customers' workloads before those bad actors are even known publicly. Our customers gain a tremendous amount of benefit, and it's really much like a network effect in the organization and the capabilities that managed defense brings to the table. And then on the side is our professional services organization, which our customers use to accelerate their cloud journey if they need to get a specific workload up and design in a ClearDATA manner quickly. Then our professional services organization is able to do that on their behalf. So all of this has given us the chance to resolve some of the fundamental stumbling blocks that healthcare organizations typically find themselves in when they're trying to accelerate their journey into the cloud. So I think Dave is going to come along and he's going to offer some of his top 5 lessons learned through his time in the industry and his experience working with ClearDATA and working with AWS. Thank you.
All right. Thank you, Wayne. So I guess at the end of the day, we all want to have some good takeaways. And I would say my takeaways after having been involved for close to 30 years now of developing medical IT solutions, most of those developed to be in the cloud, most of those developed to be hosted, many of those leveraging AI for better patient outcomes, is that the agility that is afforded by the AWS cloud is critical in both unforeseen events as well as day-to-day operations and continuous growth. And as I look at our solution, mastering the complexity of healthcare security and compliance in the cloud is hard. One thing I can say is that during a period of time when we transitioned from the late 90s when HIPAA was passed to the early 2000s when it began enforced, there was a huge scramble to find experts to hire to your staff to put in place for your company. And now having the ability to leverage a team of experts whose job it is to ensure compliance, to ensure security, it goes without saying, it is a huge lever to pull for companies of our size. Health tech companies, time to market in today's ever growing and ever changing market is key. With all of the impacts for remote healthcare with the pandemic and the overall change of our utilization of healthcare itself, I think time to market is really key. And that's one of the other levers we can pull with this solution on AWS. When I say earlier about collaboration, having true collaborative partners, make sure you're working with partners, not just providers. Don't focus on 10 cents or 15 cents or 20 cents. Focus on the true value of what your partners are delivering, and are your partners going to stand behind you in difficult times, as we've experienced that both of our partners have done for us. And as I mentioned, doing this for a long time, it is certainly much better to start secure and stay secure in an environment that you can trust, rather than to try to build security and compliance into your workload and into your product design as you go along. So when you think about rapid deployments and you think about growing new products, starting secure is key. And thank you very much. I hope you guys have learned a bit about InfoBionic, ClearDATA and AWS, and the advantages we all bring to the market. Thank you very much.